Hello everyone, myself Vinoli, working as a tutor in Tibulam College of Nursing. In today's this video, we will be discussing about care of CVP line. Let's get on to the session. What is CVP? Central venous pressure. Central venous pressure is also referred as filling pressure and is the pressure of blood returning to or filling the right atrium. Circulating the blood flows into the right atrium via the inferior and superior vena cava. Central venous pressure is measured through a central venous catheter in place. What is central venous catheter? Central venous catheter is also known as the central venous line. It is a long and soft, thin hollow tube that is placed into the large vein. Central line has multiple lumen such as proximal, distal, medial. Now let's see what are the indications for inserting a central venous catheter. One is volume resuscitation, emergency venous access, nutritional support, ino drops, hemodialysis, central venous pressure monitoring. Volume resuscitation. In order to rapidly deliver large amount of fluid or blood. For example, a person short central venous catheter is indicated. Emergency venous access is, for example, withdrawal or for medication administration. Third one is the nutritional support. In order to deliver nutrition directly into the blood. When foods or liquids cannot be given through the mouth or stomach or intestine. For example, total parenteral administration. Next one is ino drops. Critically ill patients need supports of ino drops which cannot be given through peripheral line and in such cases central venous catheter is indicated. Hemodialysis. To connect a person with renal failure to a hemodialysis machine that clears a body of waste and extra fluids. And other indication is central venous pressure monitoring. Now, what are the veins used for central venous catheterization? Common sites for inserting central venous catheter are internal jugular vein, right and left side, and subclavian vein, right and left, axillary vein, right and left, groins for femoral vein, and the final one is PICC, peripheral inserted central catheter. Now let's see central line lumen types. There are three types over there. One is single lumen types, double lumen, and triple lumen. And catheter type is, there are three types. One is tenual catheter and non-tenual catheter and PICC line. Preferable size for tenual catheter. The neck is internal jugular vein, groin for femoral vein, liver for transhepatic vein, back for translumpar veins. So these veins is or catheter is tenual under the skin. So what are the indications of the tenual catheter insertion? One is the chemotherapy medicines giving and the nutritional supports and fluids giving and the taking the blood samples. Coming to the non-tenual catheters, the preferable sites is, we have the four choices. The first choice is right internal jugular vein, and the second choice is femoral vein. Third choice is left internal jugular vein, and the last most choice is subclavian vein with preference for the dominant site. Coming to the indications of non-tenual catheters. Increasing age of patient initiating hemodialysis, increasing number of comorbid conditions including significant vascular disease, and adjunct renal replacement therapy. Equipments: sterile dressing tray, sterile cotton tipped applicators, cleaning swabs, and cleaning solutions like use of commercially available chlorhexidine impregnated sponge dressings may be used, and wound adhesive tapes which is sterile strips and clear tape and non-sterile gloves and sterile gloves are used. Procedures: wash the hands using universal steps and prepare the sterile tray and supplies and put on the non-sterile gloves and remove the old dressing and remove the gloves. And after, again wash the hands, put on the sterile gloves and remove the sterile strips and wings using the forceps. And inspect the catheter size. If there is any signs of infection, swab the site of the catheter size and notify the physician. The step 1 is cleanse around and under catheter using quarter tipped applicators. And after, we cleanse the insertion site starting at the catheter and working outward in a circular motion to a radius of 10 cm. And avoid crossing over the catheter and repeat twice using a new swabs each time. Cleanse the top and unsterile of the catheter starting at the exit site, allow to dry for some time. And cleanse wings the cleansing solution and allow to dry prior to replacing. Reapply wings by squeezing the wing together so that it splits open. Place wings on catheter. Ensure that catheter is within the channel under the wings. Cleanse catheter and insertion site with applicators and gauze soaked in cleansing solution. Apply sterile strips to secure wings. Tuck sterile strips under wings and catheter so that the catheter is supported of the skin and but secure. Apply sterile dressing is to site. Create a loose loop so that the catheter is not twisted or kinked under the dressing. After the procedure, discard the used supplies and remove the unsterile gloves and wash your hands and label the new dressings and document the file. Coming to the nurse's role, monitor for the signs of complications, assess for patency of CVP line, and sterile dressing should be done to prevent infections. Central venous pressure care per the hospital protocol. Length of the indwelling catheter should be recorded and regularly monitored. Thanks for watching this video.